For us, it's a very historic milestone. It's part of what we are doing around counties called the activation of Taifa Care and the digital health transformation agenda, which are very, very important pillars in achieving universal health care coverage. Through Taifa Care, we want to ensure that every Kenyan can access health care without financial hardship. The integration of the Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Chronic and Critical Fund is reshaping the health financing landscape in our country because it is inclusive and because it is responsive. The Social Health Authority, which is very central to this transformation, has of today registered 24.7 million Kenyans. They have already enrolled that number. And out of these, over 6 million Kenyans have underwent through the mean testing, with an average contribution of 590. That is why the governor is paying close to 40,000 for her Social Health Authority Insurance Fund. That's why I'm paying over 35,000. And that is why Mama Mboga, when she goes through the mean testing, average is 590. So our commitment to make sure that healthcare is accessible, is equitable, and is affordable has come to pass. And this is a very clear sign of public trust in the system. Nakuru County, as of today, has registered 840,386, constituting 39% of the population. So we still have huge numbers to cover in Nakuru County. We have only covered, those who have registered are only 39%. And only a fraction of the registered households have paid their premiums. A lot of people have asked us, how do the informal sector, the salaried people, their contribution is paid by the employer? How do Mama Mboga, how do the people in the informal sector, how do they pay the annual premium if they don't have the money? We have said it, Lipa Sha Pole Pole initiative has brought affordability and flexibility. And I want to tell the people of Kenya, every day between 8,000 to 10,000 Kenyans in the informal sector pay their annual premium. The Lipa Sha Pole Pole is a very progressive, because it tells you if you are to pay, for example, and this I need to make it clear, if after you go through the mean testing and you are told your annual monthly premium is 300, you multiply by 12, it comes to 3,600. Then you pay 4 months in advance. Then the balance you are told, do you want to pay weekly, monthly, or daily? And last night you could see in our system, there are Kenyans who went through that system, and daily they are paying 10 shillings, 15 shillings. And at the end of the day, the system will tell you pay. If you don't pay that day, the next day you'll pay double, 20 shillings.